Hi everyone, welcome to the community classroom. This is Dr. Tracey McCarthy, psychologist, attorney, and educator. We're going to be continuing our discussion on science on trial, and we're going to be looking at the Mycoplasma masquerade. Now, of course, some people are asking what on earth is a mycoplasma, let alone a masquerade, and we're going to address that. We're going to be looking at this Mycoplasma masquerade with respect to the current situation. This is very important because a number of individuals, for a number of reasons, are called to task to do what might look like self-diagnosing. And the problem with self-diagnosing with the current situation is that someone may diagnose themselves or someone else in an erroneous manner. And this is important because if you misdiagnose something, you will mistreat something. So you have to know what you are dealing with at a foundational level in order to know the appropriate intervention. And so one of the things that needs to take place in terms of conversation more is the issue of the differential diagnosis. And so a mycoplasma is something that requires a differential diagnosis because it's very easy to mistake the mycoplasma for something else. And so the differential diagnosis is just a process where a clinician differentiates between two or more conditions that share similar signs and symptoms. And so it's that process. I'll give you an example in psychology, and it relates to children. A child may have some symptoms that look like ADHD, attention deficit disorder with hyperactivity. However, there are some similarities between that particular diagnosis and oppositional defiant disorder. And so it's very important that a clinician distinguish between those two situations because they call for different interventions. And so you need to know what the cause is and what you're dealing with before you go and start intervening. And there is a lot of intervention going on right now without a clear understanding about what distinguishes one condition from another potential condition. And it's very important to have that clarified because sometimes a number of clinical conditions look very similar, but you really have to go through that distinguishing process. Now, because we're talking about physical manifestations, you also have to rule out cofactors. So you have to make sure that you are only dealing with that one microbe in this situation and not a collection of microbes or another microbe that is contributing to the situation or even possibly taking over the situation. And this mycoplasma is one of those microbes that has the capacity to do that. It has that CatDog-like quality to it. It's a pleomorph. It doesn't have a cell wall. It can form colonies all over the place. It can self-replicate. This is a very special organism, and it needs to be taken into consideration when doing these differential diagnoses to make sure you're dealing with what you think you're dealing with and not little mycoplasma. Now, one of the reasons people have not heard about Mycoplasma pneumoniae is because there's no real national reporting or surveillance system set up for it. The infections are supposed to, however, be very common, but we don't actually know the true number of people who are impacted. And when you look at the incubation period for this particular microbe, it's pretty extensive. And so tracing where things originated, that can become quite difficult with respect to this particular microbe. Now, the reason why this microbe came to light is because it was producing what are known as atypical pneumonias. And so people were having what's known as walking pneumonia. And so they were walking around with pneumonia without being aware of being ill. So they weren't manifesting symptoms that they understood as problematic. The other thing about the mycoplasma is, and this is what gives it that CatDog quality, it has qualities that make it the masquerader This is a microbe that is a major masquerader. It presents in some ways like a virus. It presents in some ways like a fungus. Basically, it's understood as a bacterium. And so it has all of these things going on that make diagnostic dynamics very difficult sometimes when you're dealing with this particular microbe. And it has the capacity to contaminate culture when you're trying to isolate things. And so it can wreak havoc not only in vitro, as we were talking about, but also in vivo. And so it has that name Mycoplasma, which means fungus form, that myco meaning fungus. And so it does have fungal qualities to it in addition to the viral qualities and the bacterial qualities. What's also important about Mycoplasma is that it's very small and it can replicate. It's also one of those organisms that has the capacity to evade the immune system and then invade the body. And so that's another thing that you need to be mindful of. It does have that evade-invade dynamic going on with it, and it can mimic a number of other things. And when you look down at the signs and symptoms, you can see how this can be problematic in terms of that differential diagnosis. And so it can present with a sore throat, fatigue, fever, a cough that becomes progressively worse, and a headache. And so these are things to be on the lookout for, but these are also things to consider when you are addressing that issue of differential diagnosis, which then comes back to the need to make sure that you are appropriately diagnosed. And also, it's important to note with respect to children that the symptoms in children tend to look like what's understood as a chest cold. And there's also that 1 to 4 week incubation period, which is problematic because you have people, again, if someone's walking around with pneumonia and they don't know it, you have people walking around who are able to spread this particular microbe without having any awareness of it. And so you also have a dynamic where approximately 1 in 10 people who get ill from this particular microbe, they develop pneumonia, and they develop these common symptoms that again resemble other clinical diagnoses. So you have a cough that may or may not produce mucus, fever and chills, shortness of breath, chest pain, and fatigue. Sound familiar? Exactly. And so that's one of the reasons why people need to make sure that they understand what they are dealing with. And this is one of those cases where you need to make sure you understand what you are dealing with and don't just assume that you know that it is the current situation, because it may not be the current situation and it may necessitate another form of intervention. And with respect to children, again, it's important to get the correct diagnosis so that you know exactly what you are dealing with. So for children, that means being on the lookout for things like wheezing and vomiting and diarrhea, some of those gastrointestinal dynamics. You also, when you start seeing things like wheezing, you need to make sure that you're not dealing with another respiratory dynamic such as asthma. And so again, it's very important that there be clarity with respect to what's going on with an individual and not having interventions that are based upon assumptions. Now, as with the current situation, you can see systemic dynamics with this particular microbe. And so you may see this serious pneumonia, you may see asthma attacks or new asthma symptoms, you may see encephalitis, you may see different forms of anemia, you may see problems with renal functioning and skin disorders. So again, you do have the capacity with this microbe to not only see these manifestations of respiratory symptoms, you may see symptoms and complications that are pervasive and multisystemic, just like the current situation. And as with the current situation, you can see that it's indicated that many people have no symptoms at all, and they are carrying the bacteria in either their nose or their throat area. And so if someone coughs or sneezes, then these respiratory droplets can go into the air and spread. And so it is spread primarily from person to person, but of course, as with the current situation, you can have some contact dynamics. And while there is a lot of focus on interacting with people in the public sphere, usually people don't get ill or catch things, so to speak, from random strangers that they are passing on the street. Usually people come down with things based upon close contacts, people they live with for the most part. And also sometimes people that they work with or they attend school with, but usually it's from that close contact with someone who is ill or able to spread this particular microbe. And this is just a reminder about how these types of situations manifest and grow. So in crowded settings like schools, and we've talked about the situation with the schools, and this is probably going to be a growing issue, by the way, simply because of the nature of schools and the nature of how things are being handled. And so when you have those close quarters, then it presents a breeding ground, if you will, for things to grow. And so military barracks, nursing homes, hospitals, college dorms, places, jails, places such as that. And even when you think about it, when there is a situation where a child gets ill from a school situation, those adults may also get ill in those families, but it's the family members usually of the ill school children, not the school children who were not ill, who just happened to come in contact with the ill child. And so again, it's the closer quarters that create the biggest issue. Now, while people tend to think of a cold and flu season, with this particular microbe, very similar to the current situation, illness can happen at any time during the year. This includes summer and fall, not just winter. This brings us right back to the issue of differential diagnosis and treatment. Now, it's indicated that those with mycoplasma can recover from it without any assistance, without any medication. However, if individuals actually develop that walking pneumonia that we were talking about, a physician will generally prescribe a course of antibiotics. And so hopefully that will help the individual recover a little bit faster. However, if someone doesn't even know that they have it, and they are assuming that they have the current situation, and they are also assuming that there's nothing that can be done to treat the current situation, when they are assuming that that's what they have, they may not go and get the appropriate assistance that they need, when it may be something such as this that may respond very readily to antibiotics. And this part of the discussion is really important here, because what is indicated is that when someone else gets treated for this particular dynamic with the mycoplasma, it's not going to help prevent someone else from getting ill. Someone who has had close contact with an individual. It's like if you wash your back, no one else's back is going to get clean. And so one person getting treated for something is not going to then serve as treatment for someone else vicariously under normal circumstances. And so that is something to keep in mind. As we are wrapping this up, one other thing to keep in mind about mycoplasma infection is that a person may get sick from it over and over and over again. And so they do not necessarily have a lifelong immunity as individuals have with some other situations. And so that lifelong immunity or protection or defense from future infections with mycoplasma, that's not a high likelihood. So it's definitely something to keep in mind. So if someone's had walking pneumonia one time, they may have walking pneumonia again in the future. As we wrap this Science on Trial discussion up, there are a few things to keep in mind as we've gone over, it's very important to be able to engage in that differential diagnosis, not just with scientific matters, but with life. Sometimes you may see a set of facts and you may see a constellation of dynamics, and they may look like they are pointing to a particular reality, when in fact they may not be. And this is in science, this is in law. You may have some facts, but they may not point directly to a truth. And that's why it's important to do differential diagnosis, but it's also important to keep an open mind with respect to science. A really good book to check out related to science and how scientific knowledge changes and evolves over time is Thomas Kuhn's Structure of Scientific Revolutions. I have used this book in teaching before. It's a wonderful piece because it tells you about how science evolves and how we come to different conclusions and how we learn as we go through the process of discarding what we thought was the true, sure thing in favor of the new, sure, true thing. And so this is very important to keep in mind as you research different things, including history. And so you've seen that as we've looked at historical dynamics. And so one of the other things that you can do with this with respect to children in classes for children is that you can take any sub piece of this discussion and have the children branch off from there. It doesn't matter what you're looking at. You can look at the diagnostic dynamics. You could learn a little bit more about the biology of this microbe and how it presents. It is a pleomorph, and so it has a number of things going on with it. So that in and of itself is interesting to explore. You could even do an art project with this particular little cat dog of a microbe. You can do mathematic activities with it. You can do social studies activities with it. You can do English. You can do so many different activities just branching off from this one topic. And finally, of course, this is not to be understood as providing you with medical advice or even medical information. This is educational purposes and for your own personal edification and for your own exploration. And so if you have some questions about this, this is definitely an encouragement for you to talk to your individual health services provider or wellness partner so that you can get a better understanding of this situation if it comes up for yourself. You have a lot of individuals who are presenting a lot of healthcare information, and you have to consume it judiciously. It needs to be taken into consideration. You have a lot of laboratory scientists actually doing a lot of presenting at this point. However, laboratory scientists for the most part don't really see patients, and so you need to get specific information from a specific person who sees you, who has responsibility for your wellness. And so take that into consideration as you are parsing all of these things. Remember, knowledge is power. Take care. See you soon.